What is this Ayushman Bharat Yojana? The Ayushman Bharat Pradhan Mantri Jan Arogya Yojana is one of the largest healthcare initiatives in the world. It aims to provide health coverage to over 10 crore vulnerable families, ensuring that financial constraints are not a barrier to accessing quality healthcare. But now, the government is taking a step further to make healthcare even more accessible for senior citizens.
The government just approved a 5 lakh rupee health cover under the Ayushman Bharat Pradhan Mantri Jan Arogya Yojana for anyone and everyone over the age of 70 irrespective of their income. This means 6 crore citizens of our nations who are seniors are now protected. Before jumping deeper into this topic, let's hear what people think about this initiative by the government.
So, how often do you seek healthcare in Bangalore, and what sources do you primarily go to, like government or like private clinics?
I generally prefer going to government clinic because that's the closest one nearby. And as of my health, I often get, I often have to go to hospitals for several times.
So, do you think healthcare costs in Bangalore is accessible or affordable?
It is affordable, but terms and conditions applied. It depends on what time you go, what time you prefer going, and after if it is about your classes, and they know particularly when you will go there. So morning shift might be 250 rupees just for consultation, while in the evening shift it will be 750. So depends.
And how do you think socioeconomic status is related to healthcare access in particular?
Bangalore, if you go around and keenly look around, you'll see that socio-economically there are a huge part of society that is not able to access any of it, while there is another part of society who spends a lot of money just for the smallest of the things. So it's a large difference between the economic societies here.
So, how often do you seek healthcare in Bangalore, and what do you have a particular hospital that you visit? Is it like private or government?
So I think in the past 2 years I've visited like twice or thrice, and I've been to St. John's like most of the time. I feel that it's a little bit expensive, but then it gives a really nice treatment. So yeah.
So, do you think healthcare in Bangalore is accessible and affordable for everyone?
It really depends, like which hospital do people prefer to go to. St. John's, as I said, is a little bit expensive, but there are other clinics, like there's one Suma clinic, which is a local one, which is affordable. So yeah.
And how do you think socioeconomic status is related to accessibility to healthcare in particular?
So it's not, available to everyone because it really depends on the areas people live in. So there are a certain limited number of hospitals and clinics here. So I think that people living in rural areas are not having all those how do I say they don't have the accessibility more often.
So when it comes to people living in the rural areas, they find it difficult to access the good healthcare services in the city. So that is the only probably the distinction between those two communities.
Are you aware of the Ayushman Bharat scheme proposed by the government?
I've heard of it, but I'm not completely sure about what it is.
The government has introduced Ayushman scheme, Ayushman Bharat scheme for the poor people to have their medical treatment. Because medical treatment in general is very expensive, especially middle class people and lower middle class people cannot afford to have treatment. That too, cancer patients, cardiac patients, and any long illness, those things, they cost more than 2 or 3 lakhs. In Ayushman Bharat scheme, they give free of 5 lakhs, up to 5 lakhs. It is really very, very useful because the people, middle class people, whatever they put in the bank, that money, if they don't have this scheme, they have to utilize that money for their treatment. If they utilize that, use that money, their children have to forgo their education as well as their daily needs. So it is definitely very, very, very useful for the government's Ayushman Bharat scheme.
And the best part, even if you're already under a public scheme or have private insurance, you are still eligible. Finally, some stress relief for families who are worried about skyrocketing hospital bills. Whether it's a simple checkup or a major surgery, your parents and your grandparents are now covered by the government. New distinct health cards are coming soon under the scheme.
A separate module has been created for this purpose on both the Ayushman Bharat mobile application and the web portal. Eligible senior citizens can now easily enroll themselves through these platforms, simplifying the process for those who need it the most. By using these dedicated tools, senior citizens and their families can conveniently register and start availing the benefits offered under the scheme. This includes coverage for hospitalizations, treatment for serious illnesses, and much more, all without the burden of high medical expenses. The government's efforts to extend the service to senior citizens reinforce its commitment to building a healthier, more inclusive India, where everyone, especially the elderly, can live with dignity and peace of mind.
Here is a brief overview of the Ayushman app. After downloading it from Apple Store or Play Store, it will ask you for a privacy policy acceptance, and then this app is available in 3 languages: English, Hindi, and Marathi. You can use it as per your convenience. The login process is pretty simple. You just have to give your mobile number, and then you have to choose if you are the beneficiary or the operator, and then you have to enter the captcha that's shown on the screen. This is a simple login process which is easily accessible for the senior citizens as well. On the top of the page, there is a link present for YouTube where you can see available tutorials for the Ayushman app to see how to use it and also to see if you're eligible for the app.